Vitals okay?
Yeah, no
Hey,
problem.
buddy. Hope you're still breathing after that.
Okay.
That's a terrible joke to make and put on the internet. Oh well.
Keep it.
Oh, it's keeping in,
Yep.
believe me. Some of the stuff that's said on this channel is, whew, top. Good job. Have you considered just not being stressed? Have you tried that one?
No, you know what? I tried for a little bit, didn't work.
Let us know in the comments down below how you like to de-stress. Patrick, good to finally have you in here, man.
Nice to meet you, Adam.
Patrick is yet another personal trainer from Primal Athletics, which is the facility that I'm based out of, personal training boot camp gym. He's also a fellow Golden Hawk. He's a Wilfrid Laurier graduate, so I got a soft spot for him there. Right now, he's just finished his undergrad. He's trying to figure out where to go next, thinking of physio, chiro, and he's in to learn more about the profession. So, Patrick, do you care sharing a little bit about your situation there?
Yeah, of course. So I just recently graduated Laurier.
Congratulations.
Golden Hawks.
Congratulations.
Around 2 years ago, roughly, a little bit over, I got diagnosed with Crohn's disease. Caused some troubles with school, just graduating. Kind of changed my whole philosophy on where I need to go in life, like, what I can do, can't do. So I looked into a little bit the healthcare field, more into the physio, chiro realm. I'm currently a physio assistant, so I'm around a lot of physiotherapists, getting a lot more intel and insight on how their work life, which is a very important factor for me going through. So I took a look, getting a little bit more reference, seeing how they work. So I'm interested also in chiro realm as well before I go into like applications, either masters or doctrine. So I want to take a look and get into, learn a little bit more how chiro works. And
so the great thing about both of them, well, first off, good on you for getting into healthcare, okay? Because we need more of that, especially we're in Ontario here, and like we got a doctor, we got a healthcare crisis. So the more people who are willing to go into that field, very beneficial. Now, regarding the two professions, people will ask me oftentimes, like, what's the difference between physio and chiro? And I always say that the answer to that is who you bill to your insurance, okay? Because truthfully, you're going to get so much variety in both those professions. I know great physios, I know poor physios, I know great chiros, I know poor chiros. But there's a great variety and variability in how they treat, therefore that's a tough question to answer. There are chiropractors that treat like physiotherapists, completely rehab-based. They'll be over there in the gym with every single one of their patients going through whatever it is they need to go through, which is like the traditional physical therapy approach. And there are physiotherapists that just treat like manual therapists or chiropractors, where they'll even be adjusting or cracking patients. So, at least from my perspective, I don't think I treat any differently, even if I was a physiotherapist, just because I like the way that I treat and my patients get results with the way that I treat. So you can consider that. Really try to think about how you would want to treat a patient in your office, like pull from everybody who you've seen, including, I guess, what we'll do here today, which is going to be largely manual therapy based, and then apply that to your patients at hand, right? So now you have seen a chiropractor before. A big hallmark, a classical hallmark of chiro is the adjusting and the cracking. Have you had that done before?
yeah, I've had a few adjustments. I've had quite a bit of adjustments, varying from alignments, cervical, lumbar, kind of.
So you're experienced.
So I've
perfect. Okay, that's good to hear. It's always exciting when somebody hasn't done that before, but also if somebody's just looking to learn more, but at least experience with it, it's something that we can do without having to worry too much about the rationale for it. But all the same, we'll go through kind of the classical stuff that I would do. Do you have any, aside from the Crohn's, which again, I'm sorry to hear that you're dealing with that, but still very admirable that you're able to get through your schooling despite dealing with that, frankly, bullshit. Do you have any other sports injuries like shoulders, knees, hips, ankles?
Not like I played football my whole life.
And you don't have any of those?
Have slight, not too serious injuries.
Okay.
Slight,
lucky kid.
Slight tear in my rotator cuff.
How long ago was that?
6 years ago.
6 years ago.
It's
fine.
It's pretty good. But besides that,
good.
Pretty good.
Okay, so you have been a very safe or lucky athlete, so that's good to hear. So if that's the case, then we'll probably just kind of do the usual full spine stuff that we do on this channel. And alongside, you can ask me any questions you like about the field or about comparisons or how you can best prep yourself. If you're watching this video and you are actually interested in getting into the Canada's only chiropractic school, which is CMCC, I actually created an entire how to do well on your interview video, and it is, I guess we'll put it up in the corner there, but I'm really bad at angles, so it might be in this corner, I'm not sure which. We'll put a link to that up there. You guys can watch it in your free time. Please feel free to contact me if you do want any help with admittances there too, as far as interview styles go. So Let's get into it now, okay? All right, so we're probably going to be going through everything in Patrick's spine just to see what we can get. So to start, let's take a look at his range of motion examination. So Patrick, I'm going to get you to rotate your head as far as we can to the right for me, please. Good. And I like that you're keeping your shoulders square. You're a kin major, right? Mm-hmm. So you understand what it means when I say rotate your head.
Yep.
It means you move your neck, not like
I'm not rotating my
Like I've had so many patients, oh, move your neck. Oh, yeah, sure.
Yeah.
No problem. It's like, no. Okay, anyways.
I know what you mean.
He gets it. So rotate your head as far as you can to the right. Now here, we're getting to about, I'd call that like a 75-ish, which is really good. You should rotate as far as you can to the left. So here we're getting about 80, so very, very, very close on both sides. And maybe a 5-degree difference, which is considered normal. That's not a big deal. I'll get you to tilt your right ear down to your right shoulder for me, please. Good. So we're getting a little shaky there. What's that about? Are you a shaky person? Or?
No, not regularly.
Not, are you not? Okay, so we got that. We got about 50 degrees, left to left. So we got a little bit of a decrease tilting to the left as compared to the right. The left, we're maybe able to get to about 35 degrees. The right, we can get to like 50. So a little bit of an asymmetry there. I'll get you to bring your chin down to your chest for me, please. Now, are you feeling any pulling, stiffness, tightness, any aggravation of that? Patrick mentioned that he gets headaches every now and again, but any aggravation of the headaches as you do that or no?
No.
Now, what if I do something kind of mean and push there?
Slight pull.
Slight pull where? Along the back here?
Right.
I'll get you to look up towards the ceiling for me. And that's okay too? Mm-hmm. Okay, good. Now again, something kind of mean. Still okay? Good. Awesome. Now give yourself a tight hug and rotate your whole body, or your T-spine, as far as you can. So here, oh, what happened?
Got to pull my lat.
Got to pull in your lat, eh?
Yep.
Right lat, left lat?
Left lat.
Left lat, okay. So here we can get to about 50 degrees, 45 degrees. Good. Now rotate as far as you can to the right. Okay, so a little bit less here, we're at about 40 degrees. So a little bit of a decrease in right rotation and left lateral flexion of the C-spine. So basically everything on the left side there. Now, that pull in the lat, did that kind of just come and go, like it's gone, or is it still there?
Came and went.
Came and went. All right, so nothing to be too concerned about there. And we're also going to do a lumbar range of motion. So Patrick, I'm going to get you to stand up for me, just right where you are. From this position, I'm going to get you to bend down, touch your toes for me. Does that cause any discomfort for you in the lower back?
No.
Good. Come back up the other way and extend backwards for me. Again, I like that I can use the language and he understands it. That feels okay?
Yeah, no
Yeah, buddy. Okay, good. All right. All right, time to feel through. We're going to start kind of from the lower back and work our way up into the T-spine here. Now, once again, Patrick, just so you know, there's a lot of variability in the chiropractic field. I am but one individual, and I treat in the way that my patients get results with and that I am most, I'll use the word comfortable or experienced in doing. So what I'm doing with you right now might not be reflective of what others are doing, but again, pick and choose from different practitioners when you eventually enter your own practice. So starting in the lower back, working our way up, I do feel some tension through the right SI complex, and again, that's where the sacrum or the bottom of our spine fuses into our pelvis or ilium, SI joint right there, so we'll hit that later. Let's climb up. Are you ticklish or is that tender?
No, it's tender.
Tender. Okay, so some soreness in the lower back. Were you doing deadlifts? Were you working out lately? Or
Yesterday. Yeah.
Yesterday, okay, yeah. So you got some DOMs. That's totally to be expected. That feels like a thing. All right, take a breath in for me, Patrick, and then push it all out, all the way out. Good. All the way out. Ooh, that was a really big one. Hope you're still breathing after that.
That's good.
That's a terrible joke to make and put on the internet. Oh well.
Keep it.
Oh, it's keeping in, believe me. Some of the stuff that's said on this channel is borderline professional. So, breath in. All the way out. There's a little one in there. And I don't think there's anything here, but we'll... Oh, there was a little one right there. Perfect. Okay. Good stuff. Oh, freebies. Good stuff. Okay, let's get you... It was that right side that was bothering you more. So next up, we'll actually get you on your side facing the wall. We're just going to position you here, bring this leg up, just like that. You're actually in a perfect position. So I'm going to move this mic closer. I'm just going to roll towards me. Relax. You're not going to fall. Whew. How's everything there? You release really nicely. I can tell that you keep acting, you keep moving. You're going to go right there. Perfect. So move it closer. Thank you. And same deal. Gonna roll you towards me. Relax up top. Relax up top. Good job. I can tell you've had this done before, haven't you?
Yeah.
Yeah. Okay. Very familiar. You don't get too. What the hell was that? I'll get you on your back next. Okay. Gonna be feeling through the neck now. You have no headaches currently, and to the best of your knowledge, you don't believe they're related to kind of your neck tension. It's probably more maybe the Crohn's. Have you noticed anything inflammatory, or if you're just in pain down there, you get pain up here? Or
No, not really. It just comes and goes, kind of.
just kind of indiscriminate. Okay.
More like I feel more it's dealing with stress related.
Stress related headaches. Got it. Yeah. Have you considered just not being stressed? Have you tried that one?
No, you know what? I tried for a little bit. It didn't work.
It wasn't any fun, right? No. Life was boring. So no. On a serious note, stress usually doesn't create problems on itself, but it'll take whatever minor problems we do have and exacerbate them.
Mm-hmm.
So stress management is absolutely key, absolutely essential to just about everybody's life. And now, yes, some of us are more inert against it, others are more vulnerable to it, but like, guys, I don't know if you've ever read like Stephen Covey's 7 Habits of Highly Effective People, but like, sharpen that saw. Okay, like, always take time for yourselves to make sure that you are de-stressing, because when you're de-stressed, you can do everything significantly better. So whether that's yoga, whether that's getting out with your friends or your partner or your kids, whatever it is, find time today to do that. All right. Let us know in the comments down below how you like to de-stress. There we go. There's my realtor voice. Yeah. Actually, I think that's more my radio talk show. Advertising, exactly. Yeah. All right. Well, I'm feeling some restrictions on through, so we'll start with this right side because that's where the mic is. I'm going to get you to turn your head as far as you can to the left and just relax into that hand. Just sink from that position. Good. Good stuff. That feels better to my hands. Mm-hmm. How do you de-stress, man?
Exercise.
That makes sense. I get that.
Yeah.
I intimately relate.
Yeah. And walking too, in nature.
Oh, you're a nature guy, yeah.
Mm-hmm.
That's
big on my hikes and my treks.
All right, well, ladies, he's single. He works out. He likes his long hikes and his nature walks. Mm-hmm. So there you go.
Love my animals too.
Oh my God, he's perfect. Look at this guy. He's perfect. Jeez, I should probably not advertise my patients like that. Oh well. Yeah. All right, you're in the right position there. Drop that head. There we go. Good stuff. Yeah, you handle that like a champ. You're definitely experienced with this. Okay. Patrick is a very unique patient to me for one specific reason here. And that's because when I felt through his traps, they actually, like, to my hands, they actually feel really good. Like, they're not tense. They feel strong, but they feel relaxed, which is really, really nice. But he's tender. He's complaining of tenderness in through there. Is that the case?
Yeah.
Perfect. So this is a good reason that you always need to work with the patient to figure out what's going on with them, because just because I have an opinion doesn't necessarily mean that it's the correct one. Just because the patient has an opinion doesn't necessarily mean it's the correct one. But you got to meet in the middle and discuss to figure it out. Now, this is a very benign, simple example, but that rule, that mindset can carry forward in some very, very complex diagnoses or physical presentations. So if you're a healthcare practitioner, this is your daily reminder to always talk with the patient and treat them as a partner in their own healthcare. All right, so now let's get into this. So do you know what MRT is?
No, I was going to ask, what is MRT?
So MRT stands for myofascial release technique. It's just a massage technique that also helps to work fascia more than traditional deep tissue massage. So to that end, what I'm going to get you to do is we'll start on this side with the levator scap. I know you know what that is. I need you to look up and to the right for me, please. So we're contracting the levator scap on the right side. I'm going to take my elbow, I'm going to put it right over top that contracted levator scap, and I'm going to get you to slowly look down and to the left. Now we are lengthening that levator scap against the pin of my elbow. That's the basis of MRT. We're taking a muscle from its contracted position, pinning it, and then stretching it against that pin. You should look up and to the right for me. You come right back. And now slowly down into the left. Still a little bit painful?
Mm-hmm.
Yeah? Okay, that's kind of to be expected. Good. That was a very happy sounding I'm not going to lie. Yeah, good. You should look up and to the right. Slowly down to left. Good. Up to right. Slowly down to left. We'll do 2 more, so this is the second last one, then we'll do the traps on this side. Good, up to right, and slowly down to left. Good, now I get you to face forward. We're going to do upper traps. I'm going to get you to bring the right ear down to the right shoulder. Good. Now we're going to slowly bring left ear to left shoulder. Go right ahead. Good, left to left. Oh, sorry,
Yeah.
right to right, yeah. Do what I mean, not what I say. Come on. Yeah. And left to left. Good. And right to right. Left to left. To those watching, know that if I seem scattered today, it's because we're filming this on my off day. The things that I do for all you guys, love you. Long time. All right. Right ear to right shoulder. And left ear to left shoulder. And right to right. Left to left. Good stuff. Okay, now, bad news, you have 2 sides, so we gotta do this on this side. I usually look up and to the left, and slowly down to right. Good, up to left, slowly down to right. Good, up to left, slowly down to right. Up to left, slowly down to right. Up to left, slowly down to right. Good, you can face forward, tilt your left ear to your left shoulder, please, and slowly right to right. It's another Tesla.
Yeah.
Getting a lot of Teslas in the parking lot out here. Just Oakville things. Left to left, right to right. Left to left, right to right. And left to left, right to right. Good, alright, stay there for 1 moment. I always like to end with massage gun usually with my patients. The vibration helps to relax things a little bit further. Plus it also usually feels pretty nice. So I don't only torture people in here, I promise.
Ow!
Now that's a big part of it, but not the main focus. Or maybe it is the main focus. You decide. Good job, dude. Patrick, we just finished up with him in terms of kind of doing like a full body adjustment. He released very well, basically everywhere. We did some soft tissue. Patrick doesn't have any acute issues, which is great. Okay, we don't want to always see people who are injured. Of course, if you are hurt, please give us a call. Happy to help. But there is a wellness component to seeing just about any form of manual practitioner. Okay, if you see a massage therapist, an osteopath, a physio, a chiro, probably acupuncturist, any of them on a regular basis, there are benefits to that. Regardless, Patrick, this is kind of your opportunity now to ask any questions you might have about chiro or physio or working in healthcare, anything you got at all.
Yeah, so my first question is going to be kind of answers it already a little bit too, but what's the most, common reason why people come, and how often do they come back? Like say say you have a lower neck problem or a lower back problem, how often are they really coming in? Right?
Yeah. So the answer is it varies, right? I mean, of course, let's pretend somebody woke up and they have acute, let's talk about the neck, okay, acute neck pain. Their first and probably only care or instinct, depending on how severe the pain is going to be to get out of pain, all right? Because pain sucks. We can all agree with that. So to that end, a lot of patients will be seeking something like a 2 or 3 times a week just to start from a pain perspective, okay? And that's fair. Like, I mean, you weren't in discomfort today. You were totally fine, seemingly. You had some tightness, but we treated it. But in those acute stages, the before and after effects of having manual therapy work on you, that can be adjusting, that can be soft tissue, whatever, are usually pretty profound. They're also non-pharmacological. So a lot of people are these days kind of like hesitant or don't want to take medications whenever possible. Totally fine. It's your right to use whatever interventions you like. So they're more keen on using these methods because they are, from their perspective, safer. I'm not here to say what's safe and what's not, but they just prefer the non-pharmacological route, right? So I'd say in the acute stage, let's say 3 times a week if it's severe, okay? Every single patient that comes in this office, I tell them in the first appointment, the goal is to see you as infrequently as possible, because you and they and we all have better stuff to do, okay? So to that end, a lot of patients will ultimately end up coming in either on that wellness or proactive approach that I've talked about, whether that's once every 2, once every 3, once every 4 weeks, whatever we decide mutually, or they just call me when they need me. Right? So it can range. It can range from 3 times a week if they're in acute pain to once a month if they're just an ongoing wellness patient to whenever the hell they need me. It's really up to them. They're adults. Okay, they can make their own decisions. But me as the healthcare provider and doctor have to at least inform them of the pros and cons and the available options to them. Definitely not 3 times or twice a week or weekly for the rest of their lives. That's not something we do. Except, I guess, in very specific diagnoses and circumstances where the treatment we do there help them to do their activities of daily living or their careers, for example. But those are few and far between. Yeah. Did that answer your question?
Yeah,
perfect.
Yeah, that's pretty good.
Do you have any other ones?
Yeah, one more. Personally, your personal opinion.
Yeah.
What do you find is the most effective way of adjustments? Like that you've seen that.
Okay.
Say if this person with the same exact injury, say who's focusing still on the neck.
Sure.
2 patients, you have 2 different ways of treatment, 2 different approaches. What's your favorite way? And what do you think is most
So I have favorite ways of doing adjustments. Actually, that's a question I haven't been asked before. So when I'm priming patients for this part, I say, you can ask me anything you like. Please keep it authentic. I promise you can't catch me off guard. He actually just caught me off guard with that one. I've never been asked that question, so very, very good question. All right, so I definitely have preferred ways to adjust different regions of the body because I just do them more often and I feel more confident in them. But I also have alternative ways to do just about every part of the body, right? Now, in looking at any random individual, any random patient, there's actually no way to know which way is going to be most effective to release whatever segment or area we're targeting, okay? Everybody's anatomy is a little bit different. Everybody's stiffnesses and tensions are a little bit different. A great example of this is the CT junction, or perhaps let's talk about the suboccipital region, which are the muscles directly underneath your skull, connecting your skull into your spine, the atlas, or the first vertebrae. There are 2 ways that you can, actually there's more than 2, but there's 2 ways that I do in here to release that very top area, which is associated with bad headaches. One is called a rotary, where you're actually kind of, you can use the word spin, although that sounds aggressive, spinning the skull on top of the atlas. And then there's also a lateral adjustment, which is where you are lifting the skull up off the atlas. Both those sound really aggressive. I promise they're very safe procedures when done by a trained professional, all right? But there's no way to know which way a patient is going to be more responsive or release better too without kind of just doing it.
Yeah.
So to my end, I'll always usually start with a rotary because that's one which is the spin, that's what I'm more comfortable with. That's what I've done more often. But if that doesn't go, then I'll try the lateral. And hey, if that patient releases better with the lateral, that's what I'm going to do, right? And we can apply that rule kind of to almost every other area in the spine too. Different ways to get different areas and different compositions respond better or worse to different treatments. Although the best way to do that is just give it a try, right? Yeah. Good question. Yeah. I likes that a lot. Also, if you're a chiro student and you're watching this, that's the reason when your clinicians are teaching you how to do multiple different ways of an area, just learn it. Okay? Don't be one of those, I already know how to do an upper back. I don't need a different way. No, you need a different way. All right? No. I know that now because I'm in practice, but when I was a student, I was cocky like you. All right. Any other questions, or does that sum you up?
No.
Sums you up? Perfect.
Thank you.
Well, okay. So I hope you learned some things in here. I think you did. We talked off camera as well about the professions. So overall, great to have you in. Great getting to know you a little bit better. And thank you so much.
Yeah,
Appreciate your help, Patrick.
Appreciate it.
Take care.
Don't forget to like, comment, and obviously subscribe.
Thank you so much, Patrick.